We are discussing about how to approach a patient of respiratory disease. Towards this approach, I have already discussed you how to take history. Now, after the good history, a good clinician should be able to know about the diagnosis. And if you are not able to know one diagnosis, well, you have to know about the differential diagnosis. But the indicator of good history, I must have told on previous occasion, that if you have taken history adequately, completely, then it should address finally about what is the provisional diagnosis. If you cannot think of one, you may think of 2-3 diagnoses that you call it as differential diagnosis. Then after a good history, the next part comes while approaching to a patient of respiratory disease is the examination. And as I always say that examination consists of 3 issues. The first thing is the general examination. The second thing is the systemic examination, but in systemic examination, from the history you are aware that which system is involved. So, that system should be examined first. And what do you mean by this? Examine first means you have to spend more time on the examination of the system which appears to be involved from the history. And then the third part of the examination, I always say, is the rest of the other system. So, that is how we go for examination. Now, let us talk about the general examination. I will not go much of the details, but what I wanted you to know that the general examination, although in your case sheets there are many points which are written, but as a clinician, what I usually teach my students that you should know according to the case, according to the system involved, what are the points in general examination which are very important. Even if you have a less time, so you should not miss those points. That is the idea. Since here today our interest is the respiratory system, so naturally question is that what are the points in general examination which are very important, which you should never miss. And another way of knowing this, what are the important issues, many times when you present your general examination, you say many negatives. So, probably those negatives are important issues in the general examination. Like if you do a general examination, what I always say, you have to do everything what is written in your case sheet. But then you have to know that what is the important issues and what is their importance. Like in general examination, any patient, if I examine first as a general examination, what I see, I would like to know his orientation. Is he oriented to time, place and person? Question is, what could be the importance in respiratory system? You know, when patient is in hypoxia or in hypercapnia, these may be deranged. Patient, many times we have seen, you have entered into ward and patient started behaving differently, abusing you, sometimes fighting with you. So, as a clinician, you have to understand that this is something is happening with his consciousness, with his orientation, and there as a clinician, you should suspect that whether my patient is in respiratory failure. Otherwise, for which you need ABG and other things. But even by the general examination, of just overall impression of the patient, you can know that yes, my patient may be in the respiratory failure. So, start from orientation. Means he must be oriented to time, person and space. That's the usual question we ask. Then after the orientation, what next is important in general examination? Next is important, as you say, whenever you present any respiratory case, you say, sir, there is no cyanosis, there is no clubbing. It means it is very important. If there is a cyanosis, if there is a clubbing, your differential diagnosis will be pruned down. Suppose somebody has clubbing, and if you know the respiratory causes of clubbing, so you can prune down your differential diagnosis. If I say that what are the respiratory causes of clubbing? Respiratory causes of clubbing mostly it involves the suppurative lung disease like bronchiectasis, which is very common, lung abscess, empyema. These are the three suppurative lung diseases. Suppose you got a clubbing in your general examination, and if you are suspecting out of any of these three conditions, so your differential diagnosis would become very obvious. Cyanosis, of course, it deals with the management. As I said, that history and physical examination is not only for diagnosis, sometimes it can help in your management also. If somebody is cynosed, so question is this: if somebody is cynosed and you have not examined him and you say, sir, there is no cyanosis, it means you are committing a crime. Probably you are committing a crime. So why these points are important, that why they say no, 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 it means you have to examine those points, even if you have a less time. So cyanosis, clubbing. Now question, what else in general examination may be important? In general examination, next may be important about the swelling over the feet. How the swelling over feet is important for respiratory physician is that you know that many of our respiratory patients, they may slip into the carpal tunnel and they may develop, it means they may develop a congestive heart failure, and most of the signs of congestive heart failure are extracardiac. So you have to go into the periphery and find it out, and one of them is swelling over the feet. If suppose somebody comes to you with the swelling over the feet, we know that there are hundreds of causes of swelling over feet, like anemia, hyperproteinemia, liver disease, kidney disease. But one of the causes, as a respiratory clinician, we should always keep in mind, is it a congestive heart failure because of the lung diseases? Because why it is important to detect? It is important to detect because the management will differ. A patient of a COPD who has come without congestive heart failure, a patient of a COPD who has come with the congestive heart failure, ultimately the management would differ. So that is why these points, what I am telling to you, are very important to a clinician, either to make diagnosis or to make the management issues. Then another point which is very important, which we have seen many of the students, they default, is the lymph nodes. Lymph node is another way, what you say in your general examination, most of the students are in habit that there is no significant lymphadenopathy. But I always say, when we use these words, there is no significant lymphadenopathy, what you are supposed to examine at least cervical, axillary and inguinal. So these three groups of superficial groups of lymph node, they must be examined thoroughly before you say, sir, there is no significant lymphadenopathy. I would narrate you a very small patient, a very small case, which might compel you to think that this is very important. I remember in 90s I was sitting in my OPD, some of the employee of KGMC came to me with an X-ray, chest, and he asked me that some of the professor of medicine asked my opinion about the X-rays. So I said, I saw the X-ray and I found that X-ray is normal. So I said to him, X-ray is normal. But then I ask another question to him, why you are showing me the X-ray? What is the problem with your wife? So he said, sir, my wife is suffering from fever for last 6 weeks. So I said, well, X-ray is normal, because it's a rule. If somebody has pyrexia under observation, X-ray becomes mandatory. In that way, the X-ray was done. But X-ray was normal limits. So I said, X-ray is normal. Whether respiratory system is normal or not, I cannot tell without examining the patient. That you can understand what is the importance of examination. Next day, he came with his wife, and when I examined him thoroughly, means when I said examination means, first I will examine the general examination. I just put my hands over the supraclavicular or the cervical area, and I could find the only finding in that lady was a single isolated lymph node in the right supraclavicular area. A young lady who had a lymph node, isolated lymph node in supraclavicular area, which is formed, which is not hard, likelihood is the diagnosis is tuberculosis. So I got FNAC done, and it proved to be tubercular, and I know his fever has subsided. Now question arises, then I asked that gentleman, how many doctors have seen your wife before me? He said, sir, you are the 6th one. So what has happened? What those 5 physicians did? They did, as you say in your MBBS classes, that sir, there is no significant lymphadenopathy. So they are just repeating those sentences without examining the lymph node. And in that lady, I think the sole manifestation of a disease was only finding in general examination. No other. I have just said X-ray was normal. So what I am trying to say, that these points are very important. That lymph node, many times you don't examine those lymph nodes, and you are in habit of saying, sir, there is no significant. I have seen in my own clinical practice, this is a very important for a respiratory. I have diagnosed many patients of lung cancer, tuberculosis, like thing only by sticking to this point that I have to examine the lymph node in general examination. I have already talked to you, when I say lymph node means it's not only cervical group, it's all the 3 groups must be. So lymph node is another point in general examination which is very important. Then in general examination, of course, for this system, you examine the nose, you examine the throat, you examine the oral cavity for any problem in these situations. Like I always says, you must examine the nose as a clinician. I was telling, I have seen many patients in my own life that they are just suffering from deviated nasal septum, has a deviated nasal septum, which you can at least have some idea. Finally, the answer will come by X-ray PNS and ENT exam, good ENT examination. But as a clinician, you can have some idea that whether this nasal septum is straight or deviated, and that deviated nasal septum may be linked with the respiratory symptomatology. So you will be ultimately able to. I still remember many cases where they presented to us like asthma, like COPD, and they had a very severe DNS, and when those DNS were surgically corrected, and most of their symptoms have disappeared. In fact, they don't have asthma, in fact they don't have COPD, but they have, because of this, they have a symptoms like asthma and COPD. So that is, general examination means this, that you have to look overall what are the other issues which can help me in making the diagnosis. So these are the major issues in general examination which you usually. So I said orientation, I said what else? Orientation के बाद cyanosis, clubbing, lymph node, swelling over feet, oral cavity, nose, throat. There are many issues. We have seen many patients of hemoptysis where there was ulcer into the oral cavity. And that was bleeding, and that's how the patient presented with us. You must have heard the pseudohemoptysis, means that when the source of blood is above the larynx. It may be from gingiva, it may be from teeth, any gum may bleed, any teeth may bleed, and that you can find out from the good general examination. So what I am trying to say, that general examination has its own role to play. If somebody has come to in your OPD and his extra respiratory muscles are working, so you can find it out from then and there, yes, that he has some problem in the respiratory system. So what I am trying to say, the first part of the examination, which is general examination, is very important. People feel that it may not be important, just say there is no cyanosis, there is no clubbing, there is no lymphadenopathy, so that will not work. And I always say, suppose you say there is no cyanosis, suppose you say there is no clubbing, that is why I said these negative points are very important, and suppose there is a clubbing and there is a cyanosis, probably you are not doing a justice to your patients. That is about the general examination in very brief. Then when general examination is over, I always say that suppose somebody in the history you have got cough with large amount of expectoration recurrently occurring from so many years, and if patient entered in your room, you saw his or her nails and you find there is a clubbing, your diagnosis is very clear. Probably you are going to see a case of a bronchiectasis. With the background of that history, with background of that finding, you may think of a diagnosis very clearly. So that's about the general examination.